I'm Dr. Julia Rotow. I'm a thoracic medical oncologist at the Dana-Farber Cancer Institute, and I'm happy to be speaking with you today about lung cancer screening. We've been fortunate in the past years to have many advances in the treatment of lung cancer. We've had new personalized targeted therapies, we've had new immunotherapies, and this has improved outcomes for people with this diagnosis. However, we also have a very important tool with the advent of screening programs, and we know the best way to improve outcomes for lung cancer is to diagnose the disease early. It's in an early phase of disease when treatment is more effective and where cure is more likely to be possible. And that's why these lung cancer screening programs have been such an exciting development in recent years for the management of patients at risk of this disease. So what is lung cancer screening? Lung cancer screening is an annual low-dose CT scan that can be completed through a primary care doctor or through a pulmonologist if you do follow with a lung specialist. And we know that by doing this sort of screening, it's an important component of preventive health care for those at increased risk of lung cancer, just like a mammogram or a colonoscopy is an important part of preventative health care. The National Lung Cancer Screening Trial has looked at what the benefit is of doing this sort of screening, and they've shown that by doing a screening program, you can reduce lung cancer mortality. That means reducing the risk of dying from lung cancer. And if you want to quantify this, you can look at what if 1,000 people were to enroll in a screening program, how would they do over time? And a subset of those individuals will have to have additional scans or even sometimes procedures to clarify the results of their screening test. But overall, if you look across those 1,000 people, you know that 3 people who would have died from lung cancer will be alive because of their screening. And that's why it's so critical to do this sort of program so you can catch the disease early when it's most likely to be manageable. So who is at increased risk for lung cancer and should really be particularly careful to have these conversations with their doctor? The U.S. Preventative Services Task Force does give some guidelines there, and they suggest that people meeting the following criteria really should be considered for screening. And that's people between the age of 50 and 80 who either smoke currently or have a history of smoking and quit any time in the last 15 years, and who smoked at least a moderate amount of cigarettes. I'm really defining that as the equivalent of 1 or more packs of cigarettes a day on average for 20 or more years. And if you think you might meet those criteria, or really if you have any history of tobacco use and want to talk about whether you might be at increased risk and could benefit from screening, it's a great conversation to have with your primary care doctor at your next visit. We know that as a nation, our uptake of lung cancer screening has not been perfect, and many people who are eligible for screening are not undergoing it. And this has lagged behind screening for other common diagnoses like breast cancer or colon cancer. So it's really important, and I'd encourage you, if you think you might be eligible or would like to know more, speak with your doctor about it to start that conversation so we make sure that everyone who can benefit from these sort of processes does.